my name's Ed. I'm 18 years old, and I'm a non-cystic-fibrosis bronchiectasis patient who lives in the south of England, just outside of Oxford. Most of my knowledge about the early stage of my treatment and my condition was mainly from my parents telling me, but I started showing symptoms at around 6 months old and was diagnosed with non-cystic fibrosis at 8 years old, so a long time of waiting to get my diagnosis. Now it's a lot different. Now I don't have the prophylactic antibiotics anymore. I just have an emergency set of antibiotics that I have if I have an infection. When I was a child, I was seen in a paediatric CF clinic. Even though I've got non-CF bronchiectasis, I think the presentation of the disease is quite similar. So I was seen there. So the care was more tailored towards CF patients. And actually, there was a doctor there and I'd maybe see the physio, but there was a lot less. I don't know if it was just the centre I was at, but there was a lot less interaction from nurses and physios and dietitians. But now I've only had one appointment with the new doctor since I transitioned. But the whole system with my new doctor seems a lot better. I've got the number that I can contact myself, which we had before, for the the PA, I think, of the doctor. But then we've also got the whole MDT there, and I'm seen in a specialist bronchiectasis clinic, which is really beneficial for me because actually being in a place with other bronchiectasis patients, even though it probably doesn't make a difference to how I'm treated, it makes me feel more secure that actually I know that these doctors specialise in what is wrong with me and actually they're best equipped to treat me. Because you go from being in a paediatric centre where it feels very low pressure and you're with your parents and everything, and then you go straight in my case, you go straight into the adult care where actually the onus is on you to be aware of your own condition. And actually, even though you are aware of your own condition, or I am, it's still a big step, and actually help with that would have been nice. I think having conversations about transition early is important. So maybe starting even as young as 14, 15 and saying, actually, you're a paediatric patient now and you're still a kid, but we need to start thinking about moving forward. What do you think about that? And having those open conversations early is important because then you can start to take more of the responsibility for your own healthcare and you're better informed. But I certainly think when you do transition, having your last appointment or penultimate appointment being with your doctor that you're seeing currently as a child, and then the doctor you're going to see as an adult is really important as well. So actually, you're not going into this completely new department, completely new environment to see someone who you've never met before without any warning, because I think that can be quite daunting for a patient. And actually, if that adult doctor can see you in your environment before, then they better understand you as well, and if they can have a appointment where they're sitting with your paediatric doctor, so they might be able to better understand your condition as well. And actually, rather than your first appointment being going through your history again, actually they understand your history, they understand who you are, and actually you can have better care that's more suited for you. My transition was far from perfect, and I think me being so involved with lung health and being able to talk to other patients, talk to doctors about what I should do has been really beneficial for me. And I think that most people don't have that opportunity, they don't have those contacts. And actually, I know doctors that I've spoken to that said that actually the transition process, they know the transition process is bad, but they don't really know how to change it. There's people that I know that are still with their childhood doctors after they're 18, and I think that until there's a way that's set in stone how you go through a transition, what you should do, who you should speak to, should it just be your doctor, should it be physio, should it be other parts of the multidisciplinary team, should it be dietitians, I think until there's a set rota, it's going to be up to different doctors' interpretations, what they think is important. Maybe they just let you go and go, you've gotten a point, I'm not going to see you anymore, you're now going to be seeing an adult physician, there you go, which I think does happen, especially in the UK. And I think that's an important thing to be aware of and actually understand that isn't right. People need a transition.